Hello everyone, this is Dr. Lori Langdon, board certified pediatrician, mom to 6, grandma to 2, and these are some quick updates with what's going on with lots of different viral processes currently. And this is fall of 2022 because you guys know this changes constantly. So a couple of headliners. The CDC has warned physicians to be on the lookout for acute flaccid myelitis, or AFM. And this is a polio-like paralysis following an infection with a particular enterovirus D68. Now, it is not that the CDC has been informed that there have been large outbreaks of this. It's that there are increased hospitalizations for upper respiratory infections in children, and often those have been caused by enterovirus D68. And in previous seasons, when there were increased admissions for this particular virus, then following that, there were increased cases of AFM. So certainly we're on the alert for that, but this is not a reason for panic. It's just a warning, a caution, an FYI from the CDC. Also, we are still seeing RSV out the wazoo. RSV, used to be only in the winter months, and both this year of 22 and last year of 21, we saw it throughout the summer, and it is ongoing now in the fall. Also a reminder, it is absolutely important to get your flu vaccine this year. You may remember when COVID first started, all of a sudden we didn't have flu that season because everyone was either at home or constantly masked, limited large gatherings and all that. Well, most of our behaviors at this point have returned to normal. And so it's certainly possible for us to have a pretty large flu season this year. And it's often predicted by large flu seasons in Australia, which did happen. And so we're on the outlook for a large flu season. Please get your flu vaccine. Also, in one of the biggest headlines, and for some reason, it doesn't seem people are as aware of this as they should be. We now have a bivalent COVID vaccine. So you're probably due for your booster anyway. And now, instead of getting a monovalent booster, which is showing less and less and less impact, get a bivalent booster. And there's an Omicron component, which is hopefully going to be extremely helpful in the future. We already know that if people would get this Omicron bivalent, the regular, and then the new, part of the new variant, that we could reduce lots of upcoming potential deaths in this winter season. I know everybody's tired. All of our behaviors are changing as far as getting together in big groups, and it's wonderful for things to be open. But we can't entirely forget all the lessons we learned. Careful hand washing, not going to work when you're sick, covering your cough with your elbow, and wearing masks still in certain situations. And definitely remember that the vaccine is part of what helped get us to a better place and prevent so many deaths. So please, the Pfizer product is licensed, the bivalent booster, from 12 and up, and the Moderna product 18 and up. And remember, the littles can still get their monovalent vaccine too. Work is ongoing to get FDA approval for all those to the younger ages as well, and may have changed by the time you're seeing this, because these things are moving quickly, of course, as they should. And that's a wonderful thing that we're able to get emergency use authorizations for these incredible new vaccine products. So those were all of my updates. I hope that answered some questions, and if I can be of any help, let me know. Thanks.